Zoom
Oh,
business.
really?
So I was obviously a couple of minutes late anyway. So I was looking in the invite. I'm thinking, oh God, this is Zoom as well, isn't it? So yeah.
Okay, maybe Kelly's reassigned people to another group in the second run of the signing, so maybe we'll just we'll make a start and then other people may join, but yeah, go for it, Sam.
I'm sharing my presentation, aren't I? That's what I'm going to do as well.
Yeah.
Which, oh gosh, how many things have I got open now? That's the, okay. Notice I've got the last slide open unhelpfully. Let me giving it all away. I've given it all away.
You have.
Hold on a minute. Let me do it from the beginning. Obviously, just to be conventional. So, okay, so we don't need to do introductions, do we? Because we did all of those quite thoroughly in the main meeting. So what I've got really here is a set of relatively bland slides, which is I take full responsibility for. With Sarah's input, that they're less bland than they would have been. But I'm saying that deliberately because I think what they are is a skeletal representation of what we know about Castle Point and Rochford and mental health. And so what I'm hoping is through this conversation we can kind of enrich them a bit and enrich certainly my knowledge and knowledge of key stakeholders and planners and implementers to do some effective things. And hopefully sort of enrich also sort of with that the health and wellbeing strategy and what it says about mental health. Some of the slides have data in. Some of it might be interesting to you, some of it might not be. So feel free to kind of stop me. But what I'm going to do is go through the slides quite quickly. Not all of it will be new to people. But just to say, there's kind of three things that I think would be really valuable to pull out, especially bearing in mind that, from a clinical commissioning perspective, i.e. in the CCG, we are geographically aligned to Southend and Castle Point and Rochford. So what I'd be really keen to pull out from my conversations with you guys to help it enrich the mental health part of the strategy is what is the character of Castle Point and Rochford? Who are the key players? Who are doing key things? Who I or anyone else trying to make a difference around mental health would need to know. And you'll note from that's why I was very interested in hearing from, is it Mega Centre and the other groups who are doing the stuff around the volunteers around COVID, partly because, just to be frank about it, on the back of COVID, some areas mobilised volunteers really ineffectively, but clearly in Castle Point and Rochford they were mobilised really effectively. So it's really important. That tells us something about the community fabric, which I'm keen to learn about, and those things are assets which help people stay well and prevent becoming mentally ill in the first place. And the other thing I suppose I'd be keen to hear about from you guys would be nuance, basically unheard of groups. You'll notice there's some very general data in these slides, but who's really out there, who despite the fact that on average Castle Point and Rochford is sort of socio-economically okay and health opportunities wise okay, who isn't? And that's what I'm interested in finding out about. So I'll nip through the slides. Okay, so these are the strategic drivers in mental health. They won't be a surprise to some people. The NHS long-term plan really speaks about, in terms of mental health, the fact that thresholds to access secondary care have got higher and higher. So unless you're seriously mentally ill, the commissioned NHS mental health services are going to say, sorry, go and find help somewhere else. And that's been the experience of stakeholders and the experience of GPs and primary care. That's not their fault. That's because services have been organised in silos, driven by diagnosis and, if you like, professional qualification rather than need, and things aren't done very holistically. And because of demand outstripping resource, they've had to set the threshold high. So people experience being referred off to a specialist service, waiting a long time, and if they show an ounce of improvement, entering a battle not to be discharged. I'm putting it quite starkly, but the long-term plan talks about how we change that. Another thing I suppose that's really well, and the way we do that really is about creating more capacity. There is investment to transform mental health services. That's some of it's arrived, some of it's en route.
I'm sorry to interrupt you. Can I just check? Have you changed slide? Can everyone see a different slide? Because I've still got the very first slide.
Yeah, that's right. It's only the first slide.
That's weird. Okay, I wonder why that is. Aha. Okay, hold on a minute then. So it doesn't suggest to me. What do I need to do here? Right, that's weird. I wonder how then. Why it's only. Because on my page, it looks like it's sharing the second slide. Unless what it does is, what can you see now?
It's just stuck on the title slide.
Yeah, still the first slide.
Okay. That's a bit frustrating. Right. I wonder what happens if I do this. Oh, has that done anything?
No.
No. Have you opened it as a slideshow? Because if you have, it takes it to a separate screen. So you might need to share a different screen if that's the case, or just click back onto the original PowerPoint.
Okay, so maybe then if I just go and do it this way.
Oh, there we go.
Yeah, that's it. Yeah.
All right, so I've just clicked back to fine. Okay,
Yep.
then if I go on to, hold on.
Yeah, that seems to be working now. We can see on your left-hand side you're slipping through. Beforehand, nothing was changing, so that seems to be all right now.
Yeah.
Anyway.
Great. Okay, so these are the things I was talking about. So the NHS long-term plan. So I was talking about the sort of siloed services driven by kind of specialist diagnosis rather than need. And how we it talks about how we will plan to transform that and change that. It talks about integration a lot, and you'll have heard about this a lot with primary care networks. I'm sure some people on the call will have done. And we described that as kind of three-way really, in that there's integration between health and social care, but there's also integration between mental health and physical health. I've just said, as all presenters do sometimes, I've said something completely different as I've put on the slide there. But integration can be interpreted in all sorts of ways. Primary care networks are really, I suppose, our local delivery framework around which to kind of hinge and hang services, and integration really means doing things together in a joined up way for people. And I've got in there, after primary care networks, social prescribing link workers, because they're a key part of the jigsaw, and the community voluntary sector. So there's huge opportunity as we transform mental health services to have a more enhanced role of for the community and voluntary sector. So they're among our strategic drivers, and of course there are local priorities. And so if I click onto that slide, our local priorities through a health lens and through a social care lens, I think, reflect the national things that I've just spoken about. That there are high thresholds for secondary care and there are siloed pathways. An example is in Castle Point and Rochford, for every 5 referrals a GP will make to secondary mental health care, only 4 will end up being offered a secondary mental health service. And that speaks to a number of things: really high thresholds, lack of capacity, it being difficult for GPs to know where to place people. And what that also means that there's wasted time for primary care practitioners, wasted time for secondary care practitioners reviewing referrals that are unsuitable, and of course a poor service user experience. So we're looking to address a lot of that through a range of ways that I will come on to. Of course, the other key thing that's been mentioned a lot on the call already today is COVID, the role of COVID. I said I was going to whip through these slides, and I lied, but I promise I'll whip through them now, because I think we're on the interesting bits actually. Okay, so the plans to address these. So one of the things we're doing is IPCC is integrated primary and community care. So we have we are placing 9 senior mental health practitioners, 1 into each primary care network in South East Essex. We're redesigning, and that is to meet the needs of people, as it says there, who fall somewhere between IAPT and secondary care. We're redesigning provisions so that it's more integrated with primary care, and so there's more needs-led and holistic. We've got an enhanced therapeutic offer in the Recovery College and Wellbeing Hub, as delivered by TrustLinks and partners. And a lot of what I'd like to hear from you about really is how we create a more coherent preventative offer. And that in part supports patient flow by allowing people to step down from secondary care and create capacity there, as well as changing the way those services look. Other determinants to consider. So, I mean, I mentioned I'd like to hear from you something that enriches my understanding of Castle Point and Rochford, certainly, and there are some prompts there for the kind of things we need to consider. I won't dwell on that for the moment because the conversation will hopefully be the interesting bit. Now onto the statistics. So from the Joint Strategic Needs Assessment, which is really kind of a joint community health and social care assessment of need and uses Office of National Statistics stuff. What this really tells us, I think, is that, as I said before, Castle Point and Rochford isn't particularly standout. I mean, the 3rd highest prevalence of depression and anxiety in people over 18 in Essex. Well, I think that's only amongst sort of 5 or 8 areas. I can't quite remember, but it tells you we're not a particular outlier in any stretch of the imagination. As you can see, so we've got the lowest percentage compared to other districts in Essex of residents reporting social isolation. That doesn't mean it's not a problem for individuals, but there are no statistics that really portray Castle Point and Rochford as any particular outlier. Okay, so just to give you an indication here, so this means that 0.6% of the population, the left-hand graph, will have a serious mental illness, whether that's schizophrenia, bipolar affective disorder, or psychotic depression or another psychotic illness. As you can see, that's comfortably below the England average and below the Essex, slightly below the Essex average. And then if you look at the right-hand graph there, where I'm slightly covered up by the pictures, I don't know if you guys are. It's got similar statistics for people, for children and young people. Okay. Where I think the data gets a little bit more interesting. So a lot of people may have heard of Therapy for You, or IAPT, improved access to psychological therapies. One of the front doors into mental health treatment, certainly psychological therapy for anxiety and depression and a bit of trauma and a bit of bereavement stuff, seated in primary care, as I say, one of the front doors. It relates to one of those charts on the previous slide, obviously, not the 0.6% people with a serious mental illness. It relates to the people with a common mental illness, i.e. depression or anxiety, in Castle Point and Rochford. This is just to give you an indication of how we're seeing the impact of COVID, really. IAPT, Therapy for You, sees a lot of people. It sees roughly 5,000 people or 6,000 people a year alone in Castle Point and Rochford, and more than 50% of those recover from their depression or anxiety. It's a busy and effective, well-organised service, and that's in Castle Point and Rochford alone that it sees those numbers. What you'll have noticed, so the red line is is the actual performance, and the blue line is the plan. The actual performance pretty much mirrors last year, but what you can see is in around Q1 of this year, i.e. April, May, June, as you have expected, the red line shows that people stopped coming to services. They stopped seeking help for mental health problems. This is quite interesting in the context of the previous discussion that we just had. But it surged back up already, as you can see by the red spike. I'm not going to dwell on that anymore, but here it is. So there are pets, friendly dog chasing rabbit round my flat. So I apologise for noise in the background. Okay. This is maybe an interesting nuanced fact about IAT, but I think it's certainly something we need to consider. That men are massively underrepresented. Women far outweigh men seeking help in terms of psychological therapy. That may not surprise you at all. And people over 65 are. So when we think about prevention, early intervention, and the well-being of the population, we need to consider those two facts and how we make it okay for men to reach out for help, and older people to reach out for help. Sometimes it can be generational that people aren't comfortable having that kind of conversation. We need to address that, reduce that stigma. Okay, so these were the questions that I was given. I don't know if Sarah, are you still on the call?
I am, I'm still here.
So I was just wondering how much of a rebel I can be. So I'm just caveat what I'm about to say next then. So these are the questions I was given, but for me, I suppose I just revert to those other three questions I mentioned at the beginning. You know, what is the character of Castle Point and Rochford? Who are the key players that we need to know who are doing key things that will help with mental health well-being? And calm down, dog. Sorry. And what is the nuance? What is who are the unheard groups? Who are the individuals that might not show on those statistics? Because generally in Castle Point and Rochford things are okay, but actually there's people in there hidden who are not okay. And that's it really. So they're the questions for you. There are two further slides. One is this one, which is sort of the reminder of what the Public Health England Prevention Concordat. I suppose just to frame this, people may or may not be aware that several years ago we had a crisis care concordat for mental health, which really recognised that. I suppose what it said was it was a relatively shocking starting point in that we had to get emergency care right before we did everything else. People who are likely to die today, or you know, do harm to themselves, or in very rare circumstances others who are just not getting adequate care. So we had a crisis care concordat, and we had tried to make that everybody's business: emergency services, housing, across the board, for instance. Now we have a prevention concordat, which again is a commitment for everyone to pull together. And that's a key part of the health and wellbeing strategy for Castle Point and Rochford, and you know, and speaks to the opportunity to be more preventative and think about those community assets and those key players that I mentioned. So I won't come on to the next step slide yet.
Can I ask a question at all?
Go for it. Go for it. Yes, it's over to you guys now, and I'm going to listen. So yeah. Go for it.
Okay. Ooh, several things to talk about. First of all, I mean, looking at just for the oh God, what was it? The mental health strategy, or the health and wellbeing strategy that was sent through on options on item 2, which talks about improving mental health and wellbeing. Mm-hmm. It doesn't seem to be any actual reference to the Prevent Concordat in there at all, and I wasn't sure, is there supposed to be something in there at all or not? Or
I think that was. I can answer that question now, because that was when the strategy was written in end of 2017, I think early 18, the current strategy that we've got. Yeah. And obviously the Concordat the decision was only taken to sign up to this in the last year. So that's why we're trying to incorporate it into the new strategy. But that's why it's not mentioned within our previous one, because it wasn't something that was considered at the time when that previous strategy was written.
So will it be put in there in future strategies then?
Yeah, well, the commitment plan for this is going to sit as like an appendix of our strategy. So it will be mentioned, but we're not going to go into detail, because obviously we're going to have the commitment plan that we're submitting to PHE for this anyway. So this is going to sort of be the framework for the mental health work as part of this new strategy and under this mental health priority for us anyway. So we're not going to duplicate it, but it's going to be included within the new one, if that makes sense.
So when is the new one going to be coming out then? Is there?
So the new strategy, the aim is that we will have a draft version of the new strategy to present at the December board meeting. For final sign off, the aim is for the March next year for the new strategy to launch next year,
Okay.
21. So
Okay. Cool.
yeah.
The main thing for me is for the current strategy is it only talks about the mental health disorders, schizophrenia, bipolar, that sort of stuff, and kind of it feeds into that. There's the therapy, there's a recovery college. There's we talk about kind of more demand than resources available and things, and there's this whole prevention thing. If we make sure that's those high level mental health, that's kind of the tip of the iceberg, really. We need to make sure you've got the lower tiers, the community therapy, and for me that is the big thing that's missing on here. Hang on a minute, what about the low level mental health community and the statutory IAT sort of stuff going on there to make sure it feeds to prevent those people reaching that high level of mental health issue in the first place there, where we need to have a whole strategy from mental health first aiders, community mental health, all the way up there for that. So that's what I would want to see in a strategy go for, what I prefer to see anyway. So
I couldn't agree with that more, actually. I mean, my part of my role is that early intervention element. So yeah, absolutely, for me, I do feel that is missing in the current strategy. As you say, it's quite high level, but what about that before that early intervention?
Exactly. What about everything else?
yeah, absolutely. So it was really interesting looking through the figures, because part of my role is to support the Essex Child and Family Wellbeing Service, and they're part of their contract is obviously that family support element in terms of health and wellbeing and mental health. So social isolation was really interesting to see those figures, because that until recently that was actually one of the priorities for the Rochford Advisory Board. Because in Rochford you obviously get those areas of rurality and quite isolated communities. So that's interesting.
Yeah, I question that data as well, just because it's resident survey data, and you have to sort of, I think, it's not necessarily a true representation and of the situation, because like you say, I would have thought it was going to be higher than what that figure suggests.
Yeah.
I think that's about that kind of looking into that further, isn't it? Delving into, that data and just trying to understand those specific, because I think that even if the area is not as isolated as, so Castle Point, for example, I wouldn't consider as isolated as Rochford, but there will be certain areas which may be more isolated in terms of communities and families. But
of course, you can be socially isolated in an urban area too, can't you?
Absolutely.
Absolutely. Yeah.
That can be more socially isolating if you're in the middle of in Canvey Island, where it's, more densely populated. But if you don't have any friends or networks or social groups, you can be very socially isolated.
Yeah, definitely.
I agree with the points about prevention, early intervention. Obviously, the investment at the moment is in primary care and mental health around that, and we're just about to pilot a role, a support worker role based with the mental health nurse in the Canvey PCN. So that will be a voluntary sector support worker who will provide a sort of bridge through to the voluntary community sector services, and also be able to provide some targeted interventions with those people that are struggling to access services but perhaps aren't at the level to need secondary mental health services. So that's quite an exciting development over the next 6 months that hopefully, if it bears fruit, we'll be able to roll out across the whole area.
Yeah, and I think it's a really good piece of feedback, on two levels really, because certainly in terms of the mental health strategy, which is different to the mental health and wellbeing strategy, but does need to reflect it, as you rightly imply. Building a prevention pathway is an explicit objective, and as I mentioned in one of the early slides, and pulling out the role of the voluntary sector and having a clearer, bigger role for the voluntary sector is an explicit plan. But the feedback is we need to reflect that in the health and wellbeing strategy. So that's really helpful. Just to pick apart a bit. So the point about social isolation, really valuable. But I suppose what that's also done is highlighted the difference between social isolation and the fact that the characteristics of an area with some small urban hubs, but it's also quite rural in places as well. So is there a different, I mean, what does that, this is a really difficult question, so, you know, so it might be a rhetorical one, but what, you know, is there a specific need for the population because of how rural it is? Is there enough to do for people? Are there people of transitional age who are in danger of, you know, missing out on services because of where they live?
I think transport to access services is always an issue. And obviously with COVID, we've all gone digital. So in a way, people are accessing more where they are digitally literate, but we do have people that also, you know, there is digital isolation too, if they don't have access to the internet and, you know, are not very good with technology and all of that. And a lot of people do like to do physical things. So I think the challenge, particularly in the Rochford district area, is that, yeah, transport's pretty poor, Great Wakering and that sort of thing to actually get in. And then Southend becomes your centre, doesn't it? So we can't really talk about Castle Point and Rochford without talking about Southend because of the geography and the way that, you know, the town is and people come into that to access services. I mean, Canvey Island is obviously a particular issue of access off the island sometimes, mentality to get come on and off the island to access services, and also obviously more, you know, much greater levels of deprivation and intergenerational deprivation as well. We haven't also touched on young people particularly, but I think, you know, young people's mental health, even in affluent areas, is a real issue. And we've talked with Councillor Johnson before about young people's mental health and the priorities around that, and some of the pressures that schools are putting on children to perform and achieve, and that's just, you know, the phenomenal impact on that, and then sort of self-harming and anorexia, anxiety, all of that is probably a ticking time bomb for mental health too.
Absolutely. It's very interesting because I've got equivalence of my role in other quadrants, and in other quadrants they have two boards. They have a health and wellbeing board and they have an early help or best start board. And in South, all we have is a health and wellbeing board. Obviously, not just all, you know, there's a wealth of stakeholders that come to this meeting, but my role is specifically more focused on early years and young people. And I do find when I come to these meetings that I have to really push that best start in life element of the health and wellbeing strategy. So I think that that's kind of something to consider in that mental health element.
I think you're right. And something, I mean, I think it's, we need to bring, because what we haven't got are, because it's split for the time being, we haven't got children and young people's mental health commissioners on the wellbeing group as far as I'm aware. So Sarah, that's probably something for us to take away and get representation from my counterpart in children's mental health as well. So
the point here is that this kind of ties into what we were saying earlier, in that the children with anxiety now are the mental health patients of the future. So we need to make sure they're properly spotted now to prevent that future need in the future there. What I wanted to mention, I wasn't sure if Mind were going to mention it or not, but has anybody heard that apparently there's been a partnership thing between South East and Central Essex Mind, Kids Inspire and Open Door, and they've recently been commissioned, I'm reading from Facebook here now, to support children and young people aged 15 to 18, partnership specialist early intervention service to children and young people with emerging mental health. So there's you know, low level anxiety, low mood, worries about arising from COVID. There's a telephone line there. I didn't want to kind of step on the ladies from Mind her toes, and I wasn't sure if she was going to mention it or not, but there seems to be a new service that's just recently been, you know, kind of like started or will be starting to help people, and there's you know, that's the whole other thing there. So so I wasn't sure if people knew about it or whether it was live or not, but I'm seeing it on.
Yeah, we refer somebody to it, so it is
cool.
live. Yeah.
Oh, it is happening then. Yeah. So so there you go. There's a whole new service there for that. So.
Could I come in? Sorry.
Sorry. Go for it. Yeah.
Could I come in very briefly? Obviously, I'm doing a lot of listening and not a lot of talking from my perspective. A couple of reasons. I'm very much a layman perspective on this, being just a counsellor, and also my portfolio, my role in the portfolio is being short term. But during last year, I held a specific portfolio for young people in the borough, and that now is being merged into my current portfolio for health and wellbeing. And going back to the point of young people, I mean, I could spend 100% of my time focused on the young people of our borough, you know, taking away the rest and health and wellbeing perspective. So I think it's, you know, that's an important aspect, but also in terms of talking about, or the question you asked originally about the character of the area. Yeah. Castle Point, as you probably well know, and most people know, the demographic is an older population. It's not a younger population, but obviously there is a specific, or there are specific issues with young people. But the older population, I think, is I wouldn't say is ignored in terms of mental health, but I think it's a growing problem for us. And I think you are professionals and work in this environment know that is probably the case. So, but my underlying point, I think, is that COVID has changed things a lot, both for young and older people, and we're identifying issues with regard to mental health, particularly I think in older people now. And I say younger people because you know, for example, the simple issue of going back to school. You know, I've been talking a lot with Bar and Bus recently about that, and they're increasing their mentoring schemes in schools for this term because of pupils they expect who will have issues with the pressures of going back to school in this environment and all that brings. So I think if I were to make a point with regards to the strategy, I think the current document is a useful document. The problem with strategy is, as we talked about earlier, how deep do we go? How deep do you go in a document that makes it still readable and something that somebody can pick up and understand? My fear is that if we start delving into something too deep, then this becomes uninteresting for the people who need this and need to understand what's out there for them. But I think there could be things be done to support a strategy document to provide information. And you know, there's lots of things that goes on today via social media, you know, promoting what mental health, which is really good. So I think that there is improvement to be made to the document in terms of bringing it up to date with the COVID frame around it. In terms of the going back to the unheard of, I think older people, I've made that point really. I think there's a lot more problems out there than maybe we're estimating, but that's my view from simply a layman's view of things. Thank you.
You're a representative of the community, so that's perfect. That's great. Thank you. Okay, and Sarah, are you still with us?
I am, yes.
You're always with us. That's quite good. I feel as though I'm being sort of looked after, which is because are we sort of rooted in public health, that the wellbeing strategy? So what I'm thinking is, so for instance, I know public health have sort of psychological health in schools. There's a really robust program, and I wonder if we need to do more in the strategy to reference what is happening around sort of public health response in preventative arrangements for young people with mental health.
Yeah, I mean, because we're going to create a new action plan that's going to sit alongside this strategy, because the current one is really difficult for people to report to, and it would kind of be more about mapping what is going on already which we did try to do last year, but it was proving quite difficult to get the information from everyone. But I think ideally that's what we'd like, so that we do know what's going on across the board and with every age group, really, to understand where there are gaps, because that will help us obviously identify where there's opportunities and groups that we need to be doing more with. So yeah, I mean, that's a question about the format of the new strategy. You know, what are we going to do? Are we going to kind of define the groups within the different age groups? You know, like Candice was saying, I think there is you know, a question about, do we have like a start well element to it, so that we've got a focus on early years and a focus on maybe working age, and then a focus on older adults. So they're all questions that I think we'll need to consider about the best format for the new strategy and the narrative and how we define what goes into it. And then